your station and here is your question. Okay, not much. You can just, I think, read in few seconds.
Yes, we can start.
Okay, so if you have read and understood, considering it communication skills station, please begin.
Hello.
Hello.
Yes, I'm Dr. Mahir, one of the surgical residents. I'm calling the ICU Registrar to inform him about one patient to take advice about one patient which is going for laparotomy, and also I would like to arrange for an ITU bed. Can I check? I am speaking to the ICU registrar.
Yes, Dr. Daniel Raza, ITU Registrar. Can you please summarize your case?
Good.
Yeah, nice to speak to you, Dr. Daniel. My case today is a 76-year-old lady who is known to have COPD, and she's already taking steroid for that one. And she presented with sudden abdominal pain, and the pain is sudden, and that's she have on examination she have hard abdomen. She's borderline rigidity, and then we have done investigation for her, which shows that she have an acute renal failure and hypokalemia. So we diagnose her as perforated viscous, and then we book her for OR. She's having dropped hemoglobin in the in the blood test. She have dropped hemoglobin 2 units, and then she have also an ABG which shows metabolic acidosis, and then also we did ultrasound, a chest X-ray. The ultrasound shows free fluid, and the chest X-ray. In the chest X-ray, there is no air in the diaphragm. So we are going straight to take the patient for OR. So I'm calling you to have some advice about the preoperative optimization before going to the theater. And then I would like to arrange for postoperative ITU bed. So can you help me in that?
All right. So why do you think it's a perforated viscous?
Yeah, according to the history of the patient, which
Okay.
she have sudden abdominal pain, and her examination shows hard board-like rigidity of the abdomen, and the ultrasound shows this free fluid. So we think this is most probably perforated viscous. That's why,
Okay.
we
All
book
right.
her for laparotomy.
So what fluid resuscitation will you do in this patient?
Yeah, for this patient, we need to give her crystalloid. That's maybe Hartmann solution. I give her 1 liter of fluids, And then I'll check also for cross matching because of the dropped hemoglobin. So we will cross match blood and it will be ready in case we need.
Okay, I see. And what are the preoperative arrangements do you suggest?
Yeah, I suggest that this patient should have full investigation like ECG. We need ECG and we need chest X-ray, and we need to read this chest X-ray. And then maybe we need to insert central line catheter. We need to put urinary catheter, and then I need to give her antibiotic, and also I need to check to give her steroid because she's taking steroid. So I will give her steroid, maybe hydrocortisone. I start with hydrocortisone, and then I will try to keep also contact with the anesthetist, so to review the patient perioperatively, and also I will consider um, giving oxygen, so cautiously in this COPD patient.
Okay, great. So, what do you think are the criteria for the admission to the ITU?
Yeah, the ITU admission, the criteria for ITU admission, I think if there is two organs failure or system failure, or if there is need for assisted ventilation, or if the patient have one organ failure, but there is risk of another organ to be impaired, or if the patient need one-to-one nurse care.
Okay, okay. So, regarding the COPD, so what type of oxygen mask would you apply in this patient?
Yeah, I may use Ventour mask, or I could use nasal cannula.
Okay. And how much FiO2 would be delivered in this patient?
I will use 4 liters, but cautiously, as I told you, because uh, I think we need to keep the oxygen saturation between 88, as she's COPD, so we need to keep the oxygen saturation between 88 and 92 in order to prevent respiratory depression.
Okay. And how will you calculate the potassium deficit in this patient?
Yeah, the potassium deficit in this patient will be calculated according to the serum potassium, her serum potassium. So we will deduce the normal from her value, and then we will calculate according to the weight also.
All right. And how would you replace the potassium?
I will give her like 20 to 40 millimole of potassium in one normal saline, 1 liter, and then this will be over like 1 hour. I will give her IV
Anything else?
in 1 liter normal saline IV, and then I
Okay.
will also need to do an ECG monitoring, and I will need to check her serum potassium uh, to check that's correct. This one.
All right. So, actually, I have only one ITU bed left. And what if there is one asthmatic patient coming first on this bed? What would you do?
Yeah, in that case, maybe I will continue monitoring the patient in the postoperative recovery room, and then waiting for one bed to be available.
All
Good.
right. So, yes. Okay.
Yeah, okay. So thank you very much.
You're
Good.
welcome.
Thank you. Very good. Thank you.